All right, welcome back everyone. It is 3 p.m. Eastern Time, and we are pleased to introduce our next session. This is a topic that was briefly touched upon during our introductions this morning. It's one we at the NCC have received input on from many of our patient subject matter experts with whom we partner. This presentation is guidance and tips for living in a multi-generational home during COVID-19. Our presenters will provide tips for staying healthy during the COVID-19 pandemic while living in a multi-generational home. Our presenters will define what living in a multi-generational home is and discuss the intervention of vaccines in this environment as well. So I'd like to go ahead and introduce two of our speakers. We have three speakers, and right now we're going to go ahead and introduce two of them. The first one you heard briefly, that's Ann Pugh, and she is a patient services manager with HSAG ESRD Network 17. She has more than 20 years of experience in healthcare, including 7 years in patient services for the network, and has worked as a dialysis social worker for 13 years, and uses her assessment and mediation skills to work with patients, staff, and family members in both crisis and support situations to meet the patients and their family where they're at. Anne specializes in facilitating patient and family adjustment to changes in health status with the emphasis on trauma-informed care. She helps clinical teams to improve the process through practice redesign, including a focus on continuity of care, discharge planning, patient empowerment, and the avoidance of hospitalization. I'd also like to introduce Ricklin Niku Maisie, and I apologize, Ricklin, if I did not do well with that last name, is a licensed clinical social worker in California who has been the patient services department with HSAG ESRD Network 17 since 2013. She received her BA from the University of California, Santa Cruz, and her Master of Social Work from the University of Southern California. She has more than 20 years of experience in mental health, geriatric, and medical social work, 14 of which are in the dialysis and transplant care. She made the jump from mental health to medical social work after a family member was diagnosed with ESRD and had to start dialysis. And as we've been doing with all of our presentations, we do encourage you to submit any questions that you have using either the chat or the Q&A feature as the presentation occurs, and then we have been saving those questions so that we can ask our presenters at the conclusion of their presentations. So at this time, I would now like to turn things over to Anne, who will get us started.
Hey everybody, hi, I'm so glad to be here, honored to be asked to come back again to speak with you guys. This is a version of a talk that we gave a few months ago. Some of the theme matter is the same, but of course as time has gone on with this pandemic, things have changed, right? I mean, now, gosh, we're reaching the year mark. I guess we passed the year mark when we first heard about the SARS virus and the COVID-19. So we thought it would be relevant to kind of talk about multi-generational home issues and also throw in a few things about kind of our changing situation now. I mean, now that the news is all abuzz about, there's talk of new variants, because like any virus, it changes. Like, how the flu shot is different every year, same thing with this virus. So there's talk about what is the impact of variants. Until more is known, we're not getting any break for from masking and hand washing and all the physical distancing. So we kind of wanted to talk about some of the tips from previously. Not everybody was able to attend the COVID patient webinar a while ago. And this, of course, will be recorded for people that have to leave early or can't attend all of it. But we're also going to end up with some resources that you can look into that are kind of written to help with this topic and also are patient-friendly. There's so much about COVID-19, so we wanted to share some stuff. And then also, of course, there is a section on that new mobile-friendly website that NCC is working, thekidneyhub.org, so don't forget that thing. It's pretty neat. I play with it on my phone, and it has a little shortcut so you can set it up on your home screen. It's pretty cool. So next slide, please. So, excuse me. So this pandemic fatigue is real. We're seeing it I mean, I see it every time I go into places that ask me if I had a fever, if I had symptoms. I feel myself almost in my mind going, yeah, yeah. But at the same time, I'm realizing, I mean, these questions are so important. So the forum, which is kind of a group that represents patients in the networks, they created this really neat little flyer. Some of you guys may have seen this in your clinic. I love it because it has really nice, strong colors and a strong message. So kind of hang tight. Don't kind of let up your guard now. There's still a lot of virus in the neighborhoods, and we want you and your family and your loved ones to all make it to the end of this so we can kind of get back to whatever the new normal is. So, all right, next slide, please. So what is the plan? Where are we now anyway? I had the opportunity to attend Dr. Krista Marie Singleton's talk last week. It was one of the COVID webinars, and she was talking about the science behind masking, and she kind of was talking about kind of what our objectives are as people to kind of get back to normal without being able to hug people again as soon as possible. And she conceptualized it as a stool, which I thought was kind of cool because it means that if you don't follow any one of the 4 feet, so we have physical distancing, the vaccination, the masking, and the hand washing, and there's some even recommending double masking of late. I saw some studies saying you kind of get a pretty good connection if you, protection, if you put a cloth mask over the paper one, because you know how the paper ones always have a few little gaps. So anyway, so there's the 4 tasks, and she's really kind of, she works for the CDC, and she was really paying attention reminding us that we all have to still continue to pay attention to all 4 of these legs of this stool. So, the other thing also, I mean, we're hoping that community spread will get lessened by this. And that also then hopefully will mean fewer people in the hospital, more room for ICU beds. There's also advances being made in treatments. There are some antibody treatments that are being given to patients that have, they have the COVID virus. There's all kinds of very interesting stuff going on. I was reading about some studies about remdesivir being used with pregnant women. So, it's a worldwide disease. A lot is happening. So that being said, we're going to bring it back down to home. We're going to bring it back down to how do you keep your family safe? What do I do if I don't have a lot of options? So next slide, please. So 1 in 5 Americans live in a multi-generational home. That's 20%. That's a lot of people. In 2016, that's the last time that there was a complete the census was in 2000. So this slide has from 2 data sources. One of these is the American Community Survey that was done in 2016, I think. And then the Pew Research Center analyzed the census data to come up with these graphs here. And you can see that the multi-generational homes are more likely in terms of percentages. And you can see this on this slide here. I don't know, can you guys see my pointer? In any case, it says, that it's really people that are higher risk for COVID, and what we know so far, are more likely to live in multi-generational households. So that makes this a really important talk today. So, so next slide. So, I mean, people of any age and any underlying and certain underlying conditions are more at risk for COVID. Dialysis patients and CKD patients have been added to that list. People with obesity, which as we know in this country, there are people that suffer from being overweight, type 2 diabetes, type 1 diabetes, other things like COPD, which used to be called emphysema. So these are things that are important to know. And at the same time, I mean, all of us live somewhere. We have a cohort we hang out with, family, we've got friends. And if you live with those people, it's what we call a multi-generational household. So I also like the idea of a grand family. And the idea is that it's a family where more than 2 age groups live together in the same home. So that could be adults with children whose parents also live with them. So that's kind of, if you have a grandparent, the parents, and then children, or it can be any other family members of different generations living together. There are certain areas of the country where there are a lot more multi-generational households happening. Sometimes it's cultural, sometimes it's just necessity. We all know that the cost of living is very high in California. There's also, I mean, often, you know, there's a lot of things that families can bring, multi-generational families they can help people do well in general. So that being said, I'm going to pass this on to Rick, and he'll talk a little bit more about the family power. Rick?
Thanks, Ann. Next slide, please. Okay, great. So it's important that people living in multi-generational households prepare in case someone becomes positive and take steps to prevent this from happening. Backup plans should also be created because anyone of any age can get sick with the virus, though some groups have an increased risk for severe illness from COVID-19, like those with ESRD. If the household includes at least one vulnerable person, whether that be due to their age or ESRD, then all family members should act as if they themselves are at higher risk. Oftentimes, people talk about the risks and concerns of living in a multi-generational household amid COVID-19. However, it's also important to acknowledge the strengths. These strengths can also be protective, especially when it comes to staving off feelings of isolation. So strengths. Multi-generational homes can pool resources, not just financially, but also of other things like time. For example, there may be someone who can transport a family member to their medical appointments, like dialysis, instead of having to take non-emergency van service or public transportation. Or there may be someone in the house who can run errands like picking up meds. Food supplies and food delivery may cost a bit more, but for a large family, there may be a reduction in risk and time if a designated person does the shopping. The burden of cost may also be spread over several people. Also, with more people in the home, it may be more cost-effective to buy in bulk, like at Costco or Sam's Club. There may be more people who can help with chores. One tip is to discuss this early and not assume who will do what. It may help to create a rotating schedule to prevent burnout. Also, having multiple generations under one roof can also strengthen relationships and deepen connections to your culture, especially if you have family members who are immigrants or maybe first generation here. Personally, when my mom was living with us before we moved further away, she taught my kids phrases in Tagalog and how to make some traditional foods together. To this day, my 10-year-old daughter can roll lumpias really well. Those are similar to an egg roll. And my 9-year-old son, well, he just likes to eat them. The family members may be also present to assist with child or elder care while others are at work or school. For families who have already been living with someone with ESRD, they are already aware of the risks and may already be sensitive to their loved one's needs. Patients in dialysis clinics receive a lot of education from staff, which are fact-based and often are from CDC or Medicare, and they also often get passed on to their families. So these family members then start off at a different place when it comes to learning about things like infection control. So this prior knowledge may help when it comes to discussing the importance of hand hygiene. Next slide, please. Okay, important tasks. So this is not an exhaustive list and may be applicable to all of us, but needs are heightened in multi-generational family homes, especially if a family member is more vulnerable. For some families, living in a multi-generational home is the norm. They're used to having young children, parents, grandparents, maybe even great-grandparents under one roof. For others, this is a whole new experience. A family member may have lost their home or may not be able to remain safely alone in their home and may now have to move in with you and your family. Even if you're used to living in a multi-generational home, things like schedules can change. You know, life happens. Kids may have to return to 100% virtual learning, or more adults in the house may have to work from home, or maybe a family member has a new job and as an essential worker and has to leave the home for most of the day. They say it takes a village. Well, communication is especially important for those whose village is living under one roof. So I'll quickly review these points because we'll go into more depth about each one throughout our talk today. When we make household decisions, it's crucial that we base them on factual, updated information from credible sources. There's a lot of information out there which can be overwhelming. And unfortunately, you may encounter a good amount of misinformation and disinformation out there. We're still learning new things about COVID-19, and guidance changes based on what scientists and doctors are finding. So it's just as important to ensure that the information you base your decisions on are also up to date. So attend all dialysis treatments and important medical appointments. Though COVID rates may be declining in some areas, you still want to avoid becoming hospitalized. So keep to your prescribed dialysis schedule. Also get vaccinated when it's your turn. As Anne mentioned earlier, excuse me, we are social workers, we're not doctors or nurses, so please consult with your medical team with what's best for you. Practice excellent hygiene and house cleaning consistently, including wearing a mask properly. Create a plan for how your household will access food, medication, and technology, especially if there are different people tasked with ordering versus picking up items or setting up your Wi-Fi. Communication is key when managing logistics. Brainstorm how each of you can manage anxiety, boredom, stress, staying connected, and also how you'll maintain privacy. These are all very important to discuss, especially if you have a lot of people under one roof. We used to have neighbors where I live now who lived in what felt like a super multi-generational household. They had two sets of families under one roof, two sets of grandparents, two sets of parents, and a whole lot of kids. And a lot of times we'd see 2 or 3 of their family members sitting outside on their porch. And at first, we thought that they were just really neighborly and smiling and waving. And later they told us that their house was bursting at the seams and they just needed breathing space in a more private area to talk because they couldn't have that inside. So thinking ahead and developing an emergency plan or backup plans for your child or elder care. Life is constantly changing, work schedule changes, so you may need to have a backup to your backup plan. Hopefully no one in your household will get COVID-19, but you should still create a plan on what to do if someone does. So if your loved one is more vulnerable, ask their medical team questions as they can help provide some guidance as you plan. And lastly, problem solve a plan for transportation needs, especially if your loved one receives in-center hemodialysis. What will your family do if your kid's school changes their scheduling around and now it conflicts with picking up your dad at dialysis? Talk to your staff about transportation options. Next slide, please. Okay. Excuse me. The NCC developed an excellent resource about where to find credible information on COVID-19. This, along with a number of other helpful resources, can be found on their website. Once you find credible sources, check their site often for updates. As we mentioned earlier, guidance may change over time, so discuss these changes with your family members because it may change your already thoughtfully laid out plans. Some credible sources have social media pages, so you may want to set up alerts to be notified on your phone or through email updates. Also talk to your medical team about when and where you can get vaccinated. Every state and even some counties within some states are handling vaccine distribution differently. So check with your state and county's website as well. For example, in the state of Washington, all people 50 years and older living in multi-generational households are in their 1B tier, but this is not the case in other states. Also, please be aware of possible vaccine scams. The FBI, Office of Inspector General, and Medicare all have more information about COVID-19 scams on their websites. On a related note, for your own mental health, you may want to be mindful of how much time you spend watching the news, as this can increase your stress and anxiety. Next slide, please. Okay, so discuss infection control with everyone in the family. We have a CDC resource at the end that offers helpful infection control guidance for your home with a lot more detail. If possible, people who are at higher risk should avoid caring for people of any age who are sick. As Anne mentioned, we've been in this pandemic for about a year now. People are tired. It can be easy to slip into old habits and not be as careful. For anyone who has kids, you already know that they may need extra reminders in a way that's developmentally appropriate for them. For example, my son tends to rush when washing his hands if he wants to get back to whatever it is he's doing. So if it sounds like he's washing his hands too quickly, I just call out 20 seconds of friction, and then I'll hear him run back to the sink. It can be helpful to, if your family discusses ahead of time, to give permission that all can remind each other about infection control, because ultimately it's coming from a place of love and wanting to keep each other safe. It's also helpful to keep in mind different personalities and needs. Some people may not want to be told what to do, or may be hearing impaired and may prefer for you to tap your own nose as a reminder for them to pull their mask up. Splitting and rotating daily chores among all able family members can also help alleviate some stress and prevent burnout. And staying home and avoiding crowds can also limit exposure, especially if you're in an area with high community spread. And then lastly, attend all dialysis treatments and important medical appointments, which also may be able to be done through telehealth. Next slide, please.
Hey, Rick, this is Ann. I'm going to kind of talk a little bit about some stuff too. There's been some, I remember early on one idea with children was, I think, Rick, you talked about this. It was kind of like, that thing where you can rinse your mouth after brushing your teeth and it shows the areas that you've missed. It was a similar gel that you could kind of spray on hands and kids could see where they were missing. And I think sometimes it's a good idea to remind kind of how things are going. There was also a little trick about, I think I saw on Facebook, but somebody was like, imagine working with glitter. Is there any area that glitter doesn't get into if you're 7 people on a table? It's a way of kind of illustrating how easy it is. It also can be terrifying, but kind of reminders are very helpful for families. The other thing also, in terms of burnout, you can kind of, or just being tired, I remember in Scouts, or I remember once I was invited to a Sarah Club Lodge years ago, but they kind of had a list of chores that needed to be happening, and you kind of you would kind of see every particular day what was expected of you. Like today was trash day, or today was the day you had to go pick up mom's meds at the pharmacy. So I just think, it's sometimes kind of keeping things creative and kind of fun can be really neat. Yesterday we had a multi-generational Zoom call for a birthday celebration. That was pretty fun. It's always fun seeing grandparents that kind of are a little bit confused with the entire business, but they still want to say hi and say happy birthday. So there's all kinds of cool things you can do, even if you're not in a multi-generational household. And even within a multi-generational household, if somebody's sick or is thought to maybe being sick, you can still kind of do FaceTime within the same household. So there's all kinds of really neat things we can do. There's a few more house cleaning practices we have here. Cloth face covering if you need to leave the house, of course, is a really good idea. Some people say, like, if you're exercising, it may not be needed, but I don't know. I've been kind of running of late, and I find, I don't know, when it's cold, it's wonderful in a weird way. Of course, it'd be nice to have the option not to wear it, but now, the surgical masks are available in more places, and you find that people are pretty good at kind of staying 6 feet away from each other. Periodically in Costco or like in some place I've been waiting, I've had to ask people to move away a little bit. Would you mind terribly? And people have been really pretty nice about it. And then reminders as to kind of what our procedures are. If I'm in a more risky situation, like say I'm coming home from a place that was very, very crowded, I kind of slow myself down a little bit and remind myself of steps, what to do, when to wash my hands, maybe leave my shoes outside if I've been at the hospital. So there's different things, and that can be a really good idea. Trying to slow things down and be present, having a checklist is a great idea. So, that's kind of what I wanted to throw in there with the hygiene and house cleaning practices. Rick, you want to talk a little bit about food and kind of accessing things you need when you live in a multi-generational household?
Next slide, please. Thanks, Ann.
Mm-hmm.
Okay, so when it comes to food and medications, you may have more delivery options now than before COVID. So look into those options instead of going out to eat or pick up meds. Many grocery stores offer curbside pickup when you order ahead of time, so you don't have to physically walk into the store. Also check out local outdoor farmers markets in your area. Also check with your school district if they offer food delivery for their breakfast or lunch programs, especially if they're offering hybrid or virtual learning. Local churches and community centers may also offer delivery services or volunteer services to run errands. This is also a good time to look into Meals on Wheels. Many pharmacies ship to homes, so if possible, stock up on medication and household staples, as this can reduce the need to leave your home as frequently. Check your local area on aging agency, as they often compile these types of resources. Next slide, please.
So this has been a big one. I mean, as we were saying earlier, I mean, people are getting, it was one of the patients in the previous talk. I'm sorry, I've forgotten your name. I'm so sorry. I was nervous. But in any case, you were talking about how had this happened a few years ago without the technology, it would have been a different story. But now with technology being in place and the CMS waivers allowing people to do telemedicine in areas where previously had not been allowed, the people have been trying slowly getting used to telemedicine, some of us more than others. And so, this is, there's some phrases you hear of the digital divide, the idea that not everybody has access to good enough to online services, period, not access to a computer. Maybe even if you do have access to a computer or a smartphone, maybe your signal isn't strong enough to do the video. I have pretty decent signal in my area, but a few times I've done it with, can you hear me? Am I able to be heard at this time?
Yes, and we hear you.
We hear you,
okay.
Anne.
Okay, good. All right. Yeah. So I mean, sometimes even with a strong signal, it can dip, right? Certain times of the day when everybody is online. So it's problematic. I do know that our new president is looking into some ideas of broadband for all. That would be amazing. There's some parts of the country where no matter how much money you got, you can't get great signals. So these are an issue that kind of make it difficult to kind of meet the equity of things. Not everybody can access the same needs as others. But there are a few kind of ways to do things. I mean, I have a non-interconnected mother who often will just ask banks. She's not going to the bank anymore. She's called them and they just mail her a receipt. So my mom's 87. But so these are things, also using a hotspot device. Sometimes for a small fee, you can get a little hotspot and you can kind of tether it to your phone. And it's like kind of like having a internet hub in your pocket. Going to a cafe, sitting outside a library. Recently, I hung out with a friend just through the glass. They were on my porch, and we just used our home's Wi-Fi, and they could kind of hang out outside, and I spoke inside. And sometimes, I mean, there are libraries help with internet issues. Of course, not many of us are going directly to libraries, but there are some really neat websites that help people that may not be great with computer things or may need access to affordable internet access or affordable computers even. Whoops, there went my iPod, earpod, whatever you call these things. In any case, so there's a website called seniorplanet.org, and it's a nonprofit that comes out of New York, but they've got all this cool stuff. They've got a very super accessible website that they also have tech assistants. You can call them and say, hey, I'm sitting here, I'm trying to make the video work and I just can't figure it out. And they work exclusively with seniors. They also have seniors that kind of volunteer a little bit of time to help other people learn things. It's a nifty website. There's like people that have posted videos of how to crochet. I really like it. And I think one of the slogans is something like aging with attitude, which I don't know, I think that's where I'm going to be. But in any case, check it out. I think, you'll be able to get these slides online. You can click on it. There are also various areas where you can get computers. I have seen even internet providers. If any families that are eligible for food stamps, and for instance, in my area, they can get super, super cheap access to the internet through the video providers in our area. So make sure you kind of look into that. Also, what Ricklin mentioned, the Area Agency on Aging, they have a lot of things that are helpful for people that are disabled or at home. And then, of course, dialysis social workers, we are kind of resource queens. We tend to know what's available. We love sharing cool things with people. So hit us up. We're always happy to help. And if you find something super successful on your own, let us know so we can turn and share the love. All right, so let's see. I have lost track where I am. The next slide, please. So I do believe Ricklin will take this one.
Yeah,
Go for it.
So as social workers who used to work in dialysis, we strongly encourage you to reach out to your facility social worker to assist with managing stress, anxiety, and even boredom. It's important for everyone in the household to take care of their mental health. COVID-19 has been stressful, and everyone reacts to stress differently. Getting enough sleep, eating well-balanced meals, meditating, taking care of your body and mind can help cope with that stress. Within your household, this may be a good time, or this may be an opportunity to share stories, and pictures, songs, almost anything from your family history. There's a great game that my family's played called Storymatic Rememory, where you pick a few cards from a box that has a few prompts, and then you share your memory. You can do it verbally or act it out, or even sing an old song on the ukulele or do an old dance from when you were a teenager. It's a really fun way to share memories, all while making memories in the process. Brain games like Scrabble can be played within your household, and other favorites that can be played online like Clue or Uno, Battleship, even Monopoly. So you can then open up your household virtually to other family members or friends. Exercising, like walking or biking together as a family outside, going for a hike. Sometimes talking about sensitive subjects can be easier to do when you're walking next to a person versus sitting in front of them face to face.
Good point.
There may be times when we may need our space though, but this can be hard. If you're living in an apartment building, you may want some rooftop time, or if you're in a house, consider spaces that you might not normally spend time in, like your garage or a deck or a patio. As many have posted on social media, this can also be an opportunity to learn something new. You can learn something new as a family, or have someone in the family teach the rest of the family something new, whether it be baking or gardening, learning how to sew or knit, an instrument, origami, or even doing a service project together like making cards for essential workers. Next slide, please.
Yeah, there's some other cool stuff going on. I don't know if anybody has heard of an app called Nextdoor, but in my area, there's all kinds of like teenage kids that are kind of at home, more or less paying attention to their Zoom schooling, but they're also helping neighbors do things. So there's often kind of community support, neighbor support. One of our neighbors is baking fabulous things and dropping them by for my mom. Also, sometimes even though you may be in a multi-generational household, maybe one person is not able to be part of it. Like maybe you've got a son who works in a busy store and they're living on their own for now, maybe with their girlfriend or something, I don't know. And you don't get to see them, kind of setting aside a little bit of time to meet with them. My sister is in Canada, and so every other day, she and my mother are spending a fair amount of time talking. And you bet, I mean, I'm sure there's stuff she's finding out about my mom and vice versa. So I always kind of talk with them as well. But it's kind of another way to kind of be connected while still being around a lot of people. Kind of an odd thing. Also, I mean, there have been reports of, data, it takes a while to get. It's also hard to get data on sensitive subjects that's reliable, especially when right now it's hard to collect data just because we're not really interacting so much. So there are some indications that there have been a rise of substance abuse, a rise of abuse, like child elder abuse in households when we're separated like this. There's still data coming in. There was a Canadian study that showed that there was a 10-fold increase in elder abuse, which was just one study that they found, because part of what's going on is that, when people aren't leaving to go to other places, like think about when somebody comes to your clinic and you notice, like, I don't know, sometimes patients don't look well cared for, they may always be hungry, and sometimes a social worker will say, hey, maybe we need to get you some help at home. But now when people perhaps aren't leaving the house or a little bit overwhelmed, some things may not be happening. and children are historically very vulnerable at home. So I think having neighbors being aware of households and, you know, also mental health issues, kind of knowing a little bit about what depression looks like, keeping an eye on each other. There's a lot of information out there. These are hotlines that are available 24/7. They're often will kind of, almost all of them will refer you to someone locally. There's also something called 211. I forget if we put it on this slide, but that's kind of a national clearinghouse number that's run, I think, by the United Way. And they are amazing. I mean, I don't know. I had a patient once who called and needed an air conditioner, and they referred her to a program that got her an air conditioner. So 211 is also something that can be helpful just if you're done and you're just kind of like, what do I do? I'm just so done. My kid's acting out. And there's no school counselor to talk to, and he's bored, and it's raining. You know, this. So it's always helpful to have somebody to reach out to. There's also parent organizations in the area. There's also all kinds of really interesting, fun online games. Some of you guys may have heard of a game called Among Us. That's kind of a big deal. But anyway, so check out some of that stuff. I think it's neat. Let me see. Moving on, I mean, the other thing also is like, you know, as we are trying to figure out how to stay busy, of course, things happen. Some of us may get sick from something else. The car may break down. So Rickland's going to speak a little bit about some backup plans, just in case all our best plans fall apart, which of course they often do when you're dealing with people. Rick?
Thanks, Anne. Next slide, please. Okay, so emergency planning. So especially in times like this, it's really important to be proactive and plan ahead. Think of it like creating an illness preparedness plan, just as you would for a natural disaster. So these are some sample questions to discuss with your family and possibly with your medical team. Some households have a main caregiver, so it's especially important to create backup plans if that person becomes sick. We also don't want to forget about our pets. Can your family divvy up the responsibilities for caring for the pet or pets if that main person gets sick? So these questions can also spur other questions or topics to consider. It just highlights the importance of communication. Next slide, please.
So more ways and backup things. I mean, say you do need to share a room with someone who's sick. I mean, I recently had to take my mom for a vaccine, and having the windows open in the car can be helpful. If you're in the same room as someone, having good circulation can be a great idea. You always can, I mean, I think it's a good idea sometimes to consult with your doctor. You can kind of, I mean, if you kind of have any doubts, you can call the doctor and say, hey, you know, this is a situation. We don't have this much room. Which room in the house would you recommend at this point in my family's member disease process? There's all these different things nowadays, like how long is someone supposed to quarantine if they've been vaccinated one shot? So there's all these kind of very specific questions that are outside the scope of this talk. But I mean, here are some suggestions to think about: keeping, of course, the physical distancing between beds, shuffling around where people are staying. If there's a room in the house where that person who's ill can go, or maybe even conversely, the person who's well. I mean, say there's one person who happens to manage to be being well and is the main caregiver, maybe that person should be in that room when other people are recuperating from something. Doing some screening signals, always a really good idea. I find this also like in dialysis centers. If you have a patient that you have contact precautions with, say they've got something that might be contagious, like say they've got some kind of an infection, it can be a good idea to have a visual signal to slow the staff down that, you know, maybe that person has to use their own blood pressure cuff. Same thing at home. It's like, hey, heads up, you know, and maybe things that are dedicated to that person, maybe have those in that area. So you might not make the mistake of sharing, like, you know, having 3 plates and one of them. Anyway, you want to be, you know, keeping things kind of dedicated to that person. Washing your hands often. I've got a little hanging hand sanitizer on my purse that I carry. I just kind of use it regularly. It can be a good idea to have that kind of thing at home if you're caring for someone who's ill. So those are kind of good ideas that we can kind of give you for taking care of those who might be ill at home. Now, you know, there's more complicated stuff. Rick will talk a little bit about this if somebody actually in your home has COVID-19. Next slide.
Great, thanks. So this is actually kind of a continuation of what Anne was just talking about. So this probably goes without saying, but if someone in your home is positive for COVID-19, or if someone in your household has a test pending due to possible exposure or symptoms, notify your medical team, including your dialysis clinic. If you're not sure if that new cough might mean that you have COVID, talk to your medical team again. The good thing is that now it's easier to get tested than like last year. Also have the doctor's phone number on hand. You can program it in your cell phone or have it printed out, and call the doctor if the person with COVID gets sicker or if you have questions or concerns about the person that you're caring for. Of course, continue hand hygiene and wearing a mask. If possible, isolate the person with COVID away from those who are at increased risk. Also, if possible, have one person take care of the sick person and a different caregiver for other members of the family, of the household who may need help with things like cleaning, bathing, or other daily tasks. And vulnerable members should avoid caring for children and those who are sick. Next slide, please.
Yeah, there's actually, Eva made a really good point in chat. She pointed out that in multi-generational households, one consideration might be something like a HEPA filter. They're not, I mean, they're somewhat pricey, but they can be helpful with filtering air. Oh, and also the thing I was talking about, that gel that you can put on your hands to see how well you're washing hands, and this can be really good with younger kids. It's called Glow Germ. Glow Gel? Is that what? Anyway, somebody weighed in with that. So it's Glow something, G-L-O. Glow Germ, there it is. Thanks, Dee Dee, for that. So let's see, other things, next slide. So yeah, cleaning, disinfecting surfaces, there's all kinds of interesting rules. Read the bottles on some of these disinfectants. I was very surprised to see that when you spray something with bleach, you're not supposed to just dry it immediately. It's supposed to dwell there for a minute or so. And I don't think I've been doing that for ages. So even pre-COVID, I probably was not doing a super great job, even though I've got my bleach concentration in my bottle that I'm spraying everywhere. So keep in mind whatever disinfectant you're using. You know, often you can find out if they're good for COVID-19 decontamination, and that may be really important if you've got somebody who's coughing and is ill, to make sure you use the right product. There are kind of cheat ways. If you're having any troubles getting wipes, which were hard to get for a while, there's ways to make your own solutions that are helpful. So consider some of those. Separate bathrooms, having something to wipe down the bathroom, keeping the lid down on the pot can be a good idea if you're flushing, to stop things kind of going in the air. Sharing personal things is a good idea, or wiping things down. Phones are something that we touch a lot. Dishes, toys, you know, things that are shared. And be careful with visitors. One can meet outside if the weather is decent, or do, you know, our friend Zoom, which is what we're doing today. And then also just take care of yourself as we worry about others. There are some of us who are running around with our cups half full and are rapidly emptying. And then it's hard to refill if there's still more to go with this. So kind of be mindful of things you can do for yourself. So next slide. Thanks.
So we can't forget about transportation, especially if a loved one is on dialysis. Talk to your staff about patient options. We've mentioned earlier, if possible, pick one or two people who are not at a higher risk to run errands and wear a mask when doing so. I grew up in the city and didn't have a car, so I took the bus everywhere. If you're that designated person to run errands for your family, try to go during less busy times to make it easier to stay physically distanced away from others, and then also clean your hands as soon as you get off the bus. I mean, really, you should be doing that even when we're not in a pandemic. As Anne mentioned, have that visual reminder or checklist about what to do when you return home. That can be really helpful, especially if you're usually distracted when you get home, like if you're on the phone or telling your kids to stop messing with each other. When you're on dialysis and using a van service, it might be unavoidable to share a ride with others outside your home. The driver and other passengers should be wearing a mask, and you keep your mask on. And if the weather's okay, maybe open the windows. If possible, handle your own personal items, and also try to be mindful to avoid touching your face. Next slide, please. So all this talk about all the things you have to be careful of at home. Jimmy, no. Sorry, that's a dog. The vaccines are coming. There's tiers happening. Things are done via age.
this has been very frustrating in many areas. But at some point, more people will be vaccinated, and slowly, we may be able to figure out what to do. But in the meantime, I mean, there's all kinds of questions, and it's way beyond the scope of this talk. But things that kind of came to mind for me that you may want to ask people either at dialysis, call your transplant center, call your nephrologist, call your center. I mean, what if one person is vaccinated and others aren't? Well, one thing might be your shopper. Although they still are wearing a mask to make sure that they're not perhaps infecting others, they can perhaps be more safe from getting severe COVID. There's all kinds of concern, though. Some people may be refusing the vaccine. We have some, there's a lot of kind of talk about how do you overcome vaccine hesitancy? What are different things that people can talk to? What are different arguments? These are things that probably the NCC will be working with as well. So keep in touch on the pages around COVID. The variants, again, still being figured out. A lot of information is still coming. So keep an eye, again, the reputable, credible sources is a good idea. Always double check with somebody that you respect and to kind of see what is true. And remember, even the most respected person may know something now and it may change farther down the road. So try to make sure that you're getting current information. Local CDC is a great website. There's all kinds of local, for instance, in the Bay Area here, I trying to get my mom vaccinated, who is 87. Her health plan didn't have enough vaccines. We had to put her on every list known to man, but we just did it because it was important. And people that are older are higher risk of having something more serious, or so I'm being told. So we wanted to make sure to do that. So keep your eye on the vaccine. There's all kinds of exciting developments. The talk this morning was really good on that. If you guys missed it, check it out in recording. I thought it was very helpful. I may revisit it myself. Takes me a while sometimes with all these kind of more complicated things to get it. So checking it out again is always a good idea. And now at this point, we're going to go through some resources. Rick, this is your fun. And then we will hear from one of our lovely patients, Ms. Carrie, who's on deck to talk to you a little bit about living in her home and being in her skin and being who she is. Hey, Carrie. All right, Rick, it's on to you.
So these next two slides are great websites to check out that are easy to read with helpful tips. Next slide, please.
I love the title, Staying Away from Grandma Isn't an Option. I think that's a great handout.
Yeah,
sorry.
Next slide. Okay, next slide, please. Okay, and then this is a great resource, Guidance for Larger Extended Families Living in the Same Home. It's a comprehensive guide, straightforward, great to print out as an easy reference to keep handy. Okay, next slide, please. All right, so it's my pleasure to introduce Carrie Esser. She's been a part of Network 17's Patient Advisory Council for a little over a year. She has experience doing in-center hemodialysis and home hemodialysis and has been transplanted for over 20 years. We are incredibly fortunate to have her and know that you will enjoy hearing about her ESRD experience and how she has coped and stayed safe while living in a multi-generational household. Carrie?
Hello, everybody. Can you hear me?
Sure can.
Oh, great. So I wanted to start out by saying it's a pleasure to be here, and I'm excited to share a little bit of my personal knowledge that I've learned during this. But what I've learned in my over 30 years of being in end-stage renal disease is that an informed patient is a successful patient. So we're all in the right place. A little bit of background, it has been 33 years since I was diagnosed with end-stage renal disease. Within a year, I was on the list and transplanted. I was on the list and was on hemodialysis in clinic. I was fortunate to get a kidney transplant through a deceased donor fairly quickly, within 3 or 4 months, but I lost that kidney in 3 years. I went back on in clinic dialysis and went back on the list and was in the clinic for about 4.5 years. And then my husband, Brian, as you can see there, and I decided to do home hemo. And that was working great for us. We really felt like we had the control of the care, and it was the best option for us. But lo and behold, I got another call, and we did another deceased kidney transplant, and that has been over 22 years. So in the meantime, that was October 1998, and our son was born November 1998. So, and then our daughter, Brielle, our son Max and our daughter, Brielle, was born in April of 2002. Sometime right before all that, my mom, who is actually 85, almost 86, as you can see her there, that's Dorothy, she has lived with us the whole time, which has been wonderful. So all of us are very much so aware of how to take care of somebody that is, at that time, of course, my mom wasn't that age, but I have been always, of course, immunosuppressed. So the kids were raised with that knowledge, and they were young and getting involved with other children, of course, like we all do. And so I've always kept the house pretty clean as far as Lysol wipes, and they've been aware of it. And it's just been part of our family environment, aware of each other's needs, and wiping down light switches and handrails. And I mean, honestly, it has kept me from being sick over the years, as well as my whole family. So then COVID hit. And needless to say, it was scary for all of us, and especially myself and all of us. As I said, they've been used to it their whole lives. We all kicked into high gear. My son was, my husband was working at home a lot. He can do that as an engineer, and so, but he ended up working full time at home. My son was an essential worker in a grocery store, and as an assistant manager in a department, he ended up having to work long hours. I'll get back to him in a minute. My daughter was doing school, and she had to switch to online, and was working in a small store, and she was furloughed. So as time went on, we started to realize that the more he was working, the more demands for my son. We decided that as a family, and he was getting very concerned, that he needed to move out. And that wasn't our first choice, but it was a wise decision made by all of us as a family, and keeping, of course, now at this point, my mom healthy too. And so with two of us that are high risk, he was willing to do that for the family, and he found a friend that he could move in with. So since then, how we survived is so far so good. We have been, my daughter and I have been doing lots of crafts and doing lots of baking, and then eating and baking and eating. We both put on weight. And my husband and I have been doing lots of walking and talking, and fortunately we have a household that we can kind of escape into different rooms and backyard and other ways we can kind of find our space and our sanity. Car drives by yourself are good. And we've also, my mom is an avid reader, and we were talking about this morning. I think at one point we couldn't get library books, and so that was creating a bit of a problem for her. So I was going into my library and finding books, and she was rereading books, but if I can keep giving her books, she's great. So as time went on, we were trying to develop different ways to cope, and like I said, we were playing games and trying to just manage it and get the most information as possible in order to not live in a place of fear, but in facts and what's really going on. And as we know, this is static, it's not constant, we never know what's going to happen, so we were just staying informed. So then at some point, things transitioned. My daughter was able to go back to work in a very, the place that she was working, they were practicing really strict protocols and only letting a certain amount of people in. All along, all of us were very diligent at hand washing, the social distancing, mask wearing. That was never a problem to convince anybody about the need for that. And so that's what we continue to do. My son ended up getting another job at another store that was more diligent than ever, and ended up moving back home. And we,
hey, Carrie?
Yeah.
Carrie, this is Ann. We have about a minute left, but I wanted to make sure that you were aware that libraries, if you have a library card, often, and if you have a Kindle or an iPad, you can download books to your heart's content.
Great.
Go ahead.
Thank you. So we've been able to get books. So the bottom line is that keep wearing masks, do the social distancing, wash your hands. And if you can get the vaccine, if that works for you, you should get the vaccine. My mom was able to get it. So we're one step closer to doing a little bit.
Awesome. I hope you get yours soon. Do you want to take us out? Yeah. Hey, Kim or Jerome, you guys want to take us out?
Sure, I can do that. Thank you very much. I want to thank Anne, Ricklin, and definitely Carrie for sharing a piece of your experience with us. That's always appreciated. If I can have the next slide, please. Ricklin talked about this. She gave and we talked about it earlier. But this is the resource for living in a multi-generational multi-generational household. You can download that at the URL that we have there on the bottom of the page. So please, if you're interested in learning more about it, please visit it online and download a copy. All the information that we share today, tips, what to do if someone in your household becomes ill, is available on this handout, and it was developed with feedback from some of our patient subject matter experts. Again, I would like to thank Anne, Ricklin, and Carrie for joining us today and talking about this very important topic. We will be back here in 4 minutes for our final session of the day. So, and on the screen now, we have some contact information for Ricklin and Anne if anyone has additional questions. And again, we'll see you in 4 minutes. Thank you, everyone.
Thanks, everybody. It's been a pleasure.
Thank you.